This is Up to Date on KCUR 89.3. I'm Steve Kraske. Did you know that a tick bite has the potential to give you an allergy to red meat? It's called alpha-gal syndrome, and it's on the rise in Kansas and Missouri, public health officials say. With us to talk about it is Dr. Rex Archer. He's a professor of public health at Kansas City University and formerly the director of the Kansas City Health Department during the COVID-19 pandemic. Rex, welcome back to the show. Good to see you again.
It's good to be back, Steve.
So alpha-gal's on the rise in Missouri and Kansas. What have you been hearing about its prevalence here?
So this is an extremely underreported disease because, unfortunately, it's not yet mandated by CDC to be reported by states, and many of the states that have the highest prevalence of the tick that can cause or spread this disease are not reporting it or mandating it.
So that really puts us behind the eight ball when it comes to really understanding just how serious of a problem we have here.
Absolutely.
But we know it's still a serious problem, though, right?
Oh, yeah. I know individuals that have gotten this.
Yeah. And tell us about that. What are they dealing with?
Well, it can really range, and it also depends on is it one occurrence from one tick, or do you keep getting exposed to ticks because it appears that you can get more and more sensitized with a lot of different allergies. I mean, think of this as an allergy like somebody that has a severe peanut allergy. You can have shortness of breath, you can go into anaphylactic shock, or you can just have nausea and some little bit of breathing problems.
You say it comes from a tick bite, but how does that cause an allergy to red meat, Rex?
So it turns out that the tick has a type of a sugar, alpha-gal, that is then injected into the person when they're biting and then sucking for the blood.
And then I've read that antibodies begin to build up.
Right, and the body sees that as a foreign substance, and when it's building up those antibodies, it turns out that then can react to all of your mammalian meats. So it's not a problem for chicken or fish, but it is for rabbit or venison or beef or pork that you can have reactions to it. And those reactions usually occur 2 to 6 hours after exposure.
You know, a lot of people think of Lyme disease when it comes to tick-borne illness. How does alpha-gal relate in severity?
Well, both of those have a range of severity. So you can have folks that actually appear to maybe have had alpha-gal. The antibody testing that is done can be positive, and yet they don't really seem to get symptoms when they eat red meat, all the way up to folks that can 2 to 6 hours later, go into really an anaphylactic shock. And unless they have an EpiPen and are in the emergency room pretty rapidly, they may pass away from it.
Wow. In just reading about this, once you get alpha-gal syndrome, you're going to have it for quite a while.
Yes, it's a chronic disease, but it does appear that for some folks it can kind of slowly wane off, and if they're being very careful about not getting exposed to more ticks, then they can kind of get desensitized to it. Not everybody is lucky enough to have that experience. Some, though, this is a permanent meat allergy. And in addition to being called alpha-gal, sometimes it's actually called red meat or tick-borne meat allergy kinds of things, which I think are a little bit more descriptive for the lay public.
And again, just to be clear, the more tick bites you get, the worse this situation can become.
Absolutely. You can keep sensitizing yourself and making it worse.
Wow. Well, the WNYC podcast Radio Lab did a show about alpha-gal back in 2016, and in it they talked to a person who has it. I want to play a short bit of it just because it's a great episode, and in this clip, one person, Amy Pearl, describes her symptoms the second time they occurred, but before she realized what was going on.
And then, about a week or two later, I made some cheeseburgers. And I ate a cheeseburger, and I was watching Goodbye, Mr. Chips. Really tear-jerking movie, and a good book, too. And about a couple of hours after I ate, I was like, started to feel really weird. Again, I was like feeling like I was like, had to stand up. I was like, I think I'm going to faint. I feel really lightheaded. I can't catch my breath. I feel like really woozy, but if anytime I lay down, I really felt like I was going to faint. So I was like trying to stay sitting upright, and I was like, oh my God, this is very similar. And I ran into the bathroom, and I was like looking in the mirror, and lo and behold, I had hives all over my stomach, and then they started coming out of my hands, and I was like, oh my God, something's happening. And at one point I did get up and unlock my door because I did feel like I'm going to pass out, call an ambulance, and then they're not going to be able to get in. So, I mean, I was a little bit afraid of what was happening.
Well, that's not too scary, is it? Yeah, wow. Yeah.
Yeah, and that's why even though EpiPens are fairly expensive, folks that are having those types of reactions to whether it's peanuts or alpha-gal need to have an EpiPen and have and know how to do those kinds of things, making sure that when you call the ambulance that your door is unlocked is good advice.
How long has this condition been around, Rex? I mean, give me a sense of its history, especially out here in Kansas and Missouri.
Well, we've seen it for several decades, but again, because it's not a mandated reported disease, it's a little hard to track how fast it's increasing right now. But there's no question that climate change and the warmer summers and the cooler winters are increasing the risk of these types of diseases. And
why is that? Because the population of ticks that cause this is coming up from the south?
They tend to do better in warmer weather, so yes. Although this tick can go as far north as Minnesota, but it is mostly in the southeast.
How often do tick bites result in this condition? I mean, if you get bitten, are you going to get alpha-gal?
No, you don't. And also removing the tick correctly is really important. So when you're screening for the tick and you're trying to remove it, you want a very needle nose type of plier, and not something that's too large, because you want to get right next to the skin and pull kind of at that place that it's hooked on. If you squeeze the body, you actually can squeeze the contents into the body and increase the risk of this situation. So
you want to go right down to the skin and sort of gently remove this thing.
And gently pull and release. Don't squeeze hard, just pull gently right at the surface. Not if you try to do it with your fingers, you're going to squeeze the contents of the tick into the person.
So why isn't it that every time somebody gets bitten, they don't develop alpha-gal?
So that's a great question, and we don't fully understand this. This is why we need more reporting and more research to actually figure out what is different about folks that are getting it versus folks that aren't, and folks that get it but have milder cases. Understanding that is going to take some research. But when we so underfund and starve CDC and research right now, we're probably not going to get those answers.
Who is most at risk for contracting alpha-gal?
Well, folks that are out a lot. So farmers, hunters, folks that like to walk their dog, particularly in areas where there's higher grass or brush, or let their dog get out there. If you don't put the tick preventive medicine on your dog regularly during the seasons when the ticks are out there, then you can also bring the ticks home on the dog and get them from that. So, but it's really the farmers, the hunters, folks that are out a lot, road workers that may be out there cleaning weeds, and husbands or wives that are cleaning up brush around the house.
Well, those are the environmental factors. Is there anything physiological about who might be susceptible to this?
We've seen less of it in kids right now, but we're not sure if that's just because the kids aren't in those occupations where they're getting higher levels of repeated exposure or not. So, again, that's really unknown at this time.
It's interesting to me. There's one Missouri lawmaker, Matthew Overcast, a Republican, who says that 3 of his kids have alpha-gal syndrome. Is there, anything other than spending a lot of time outdoors that might make you susceptible?
If you're not taking care to avoid getting exposed when you're outdoors, so if you're not using EPA insect repellent, DEET, or some of those, and even if you're just walking in moderate high grass, spraying that at least around your ankles, and that can kind of reduce your risk a little bit. The state legislature actually had a bill in this last year to mandate the reporting, and the reason that they didn't pass it was they put a fiscal note on it and said that they didn't have the money to handle that. But again, when we are either last or dead last in Missouri in regards to funding for our state and local health departments, then that's why they didn't have the funding. So if we actually funded close to what the average health department gets across the country by different states, then we could easily have mandated the reporting of this.
Again, if you're just joining us, you're listening to Up to Date on KCUR. We're talking about something called alpha-gal syndrome spread by ticks. We're visiting with Dr. Rex Archer, a professor of public health over at Kansas City University. He's formerly the director of the Kansas City Health Department. That's maybe why you might recognize his name. Our phone number here, 816-235-2888. If you have questions about alpha-gal syndrome, 816-235-2888. So where does the research stand today, Rex? I mean, what's being done about this?
Well, I think that's the challenge is, and not just the research, but also the updating of information is slowing down on CDC's website. We're basically, we've been starving CDC in regards to funding, and there's a story I learned when I was Appalachian County Health Director about a farmer who had their prize workhorse that pulled the plow, and his kids were wanting the best clothes and toys, and so he decided to cut back on the oats for that horse. And the horse did okay over the winter, but then the first day of the season when he was out plowing, he came in the next day and the horse was dead because he'd starved it to death. Unfortunately,
you're making a point here, aren't you?
Unfortunately, that's what we're doing with the CDC right now. We're starving it both with resources, money, and exiting of staff.
Is there a surefire way to tell if you have it or not?
You have to really have a physician make the diagnosis. And the diagnosis includes exposure, history, symptoms, and then there is a blood test that we can draw and do that's available in a number of commercial labs and some state health department labs. But that test being positive without other history isn't confirming or definitive, so it takes a combination of both.
So living with this thing, dealing with it, I'm just thinking, what a hassle. I mean, if you like red meat and suddenly you have alpha-gal, your diet's going to change pretty dramatically, isn't it?
Absolutely. Fortunately, people can get plenty of good quality protein from birds and fish, so poultry and fish. Some folks do react to milk products because milk products are mammalian, but a lot of folks don't.
Mammalian meaning derived from mammals.
But eggs are still fine because they're from poultry. So in many places, folks live longer and healthier that eat more poultry and fish than red meat anyway. So For some folks, this actually changing their diet may be healthier anyway.
Yeah.
But I do like an occasional red meat.
Well, Hallie Jackson, our producer before this show, spoke with Rachel O'Halloran, a nutrition and health specialist over at MU Extension, who's working right now to survey Missourians' needs related to education and outreach about alpha-gal syndrome. And what she's finding out is that a lot of people are saying they need some support when it comes to the lifestyle changes that come when they've contracted alpha-gal syndrome, because, again, we're talking about some pretty big changes here.
Yeah, changing our diet is always a challenge, particularly with the advanced marketing that various groups have in pushing their particular items. But I can tell you that I've had friends that have decided for health reasons to reduce or stop their red meat consumption and are doing fine with fish and poultry and eggs.
Again, there are some upsides to that, having to make that kind of change. Let's go to some phone calls at 816-235-2888. Vicki from Lawson, Missouri. Vicki, you're on the air, and I'm sorry to hear that you have alpha-gal.
Yes, I do. I've had it for 12 years.
Tell me about it. How is it living with it?
It's not fun at all. At one time, it was about 4 years between tick bites, and I could eat things like milk and butter. People don't understand that it's not just the meat, but anything that comes from a cow. You can't have milk, butter, cheese, so you have to get into these plant-based things, which is really hard. You have to do all of this research and stuff. But actually, after 4 years of not being bit by another tick, I was able to have the milk, the cheese, and stuff like that. I still couldn't have the meat. But I live okay on chicken and fish. Luckily, I'm one of those that like fish. Some people don't like fish, so It would be bad for them, I wish I understood why, like my husband, we lived in Stockton back in the woods, and he got bit every day by ticks, and he never got it, but I did. So it must be, I'm guessing, the blood type or something silly. I don't know.
Yeah.
I wish I understood that part. But I always carry my EpiPen.
I was going to say, Vicki, can you talk about how you do react to it if you do eat something that you shouldn't be eating?
Well, to me, there's two different ways. Cross-contamination. If I take a veggie burger to a barbecue and they put it on the grill with the rest of them, it gets just a little bit from the hamburger, use the same spatula and that kind of stuff. Then I kind of get just some itchy hives. But if you go to a restaurant and they say that this is chicken, but it has some beef in it, I have actually been in the hospital 4 times with the anaphylactic shock because it makes your throat close off. People don't understand it's actually your swallowing throat, not your breathing throat, but because they're side by side, that's how it closes off your breathing because it swells so badly you'll stop breathing.
Wow.
So, it's a terrible thing. You think about somebody give you a hamburger, you could die.
Yeah, no kidding.
That's pretty bad. So.
Well, Vicki, you're so kind of call. I'm sure sorry you're dealing with this, but I think you've offered a precautionary note for a lot of people here. Thanks so much.
Well, and the thing of it is medication, too. Did I say that?
No.
There's a lot of things in medication that we can't take. Gelatin. Wow. I can't eat Jell-O because that's from a cow. So there's so many things. If you have a capsule, you have to open it up to take the medicine. Okay.
Vicki, thanks for the call. Much appreciated. And good luck. Yeah. Paula from Eureka Springs, Arkansas. Paula, welcome to Up to Date.
Good morning.
Good morning.
So Valerie Hogan, my dear friend, called me yesterday to tell me you were going to be on with this show today.
Right.
I was diagnosed 2 weeks ago here in Arkansas. I'm from the Kansas City area. I'll be coming back up there. I got another tick bite just walking from my car to my front door this week. And, of course, that's one of the worst things that can happen. So 2 things. One is people need to know that the standard tick panel does not include alpha-gal. I was bitten a year ago. I had the tick panel, the Lyme disease, and the other two came back negative. They didn't do the alpha-gal tick panel. So,
and
like
Paula,
a
hang
lot
on a
of
second.
people,
Can we change that, Rex? It sounds like that's something that needs to be addressed.
No question. It needs to be updated. And again, to get those panels changed, it helps to actually have the number of cases that we're hearing about. But we know that there are a lot that aren't being diagnosed in part because of that. Up until 2022, there were about 110,000 cases that had been reported, but the CDC estimates at least 4 times that are probably out there because we're not diagnosing it effectively and reporting it.
Yeah. Paula, I cut you off. Go ahead. I'm sorry.
No, that's fine. I just think it's really important for people to know that because otherwise they could get a way earlier diagnosis.
Mm-hmm.
Because then you're sick for all that time.
Right.
Secondly, since I'm going to be coming back up there, I'm wondering if there are any physicians in the Kansas City area that specialize in this.
You aware of anybody, Rex?
I'm not aware of physicians that are specializing just in this. I think one of the important things is that as a physician, when you are looking at a patient that's having symptoms, you have your differential diagnosis, and depending on what's happening at the time, that diagnosis can change.
Mm-hmm.
So if you are getting reported cases of flu or COVID, then you're more suspicious of that at that time, and it comes up in your differential diagnosis. So if we were actually getting mandated reporting, we could tell our physicians, yes, we are seeing a whole lot of this here. It would be easier to get the insurance companies and the labs to change their process.
That's why it's so important to get mandated reporting, because you suspect the numbers for alpha-gal are pretty significant.
Are way underreported now, yes.
Yeah. Well, Paula, thank you so much for the call. Much appreciated.
Thank you.
So just quickly, if you're going out in the woods, be careful, Rex. That's your message here today.
Yeah, I mean, we still need to enjoy the outdoors and take care of it, but we need to be prudent. I don't walk my dog without spraying the protective DEET or whatever EPA is approving that you have, at least around my ankles and places where I think I may come in contact with brush.